Hi, this is Henry presenting on our poster. I worked on it with Dr. Margolis and Dr. Boyajan and medical student Ryan and Sabra. We've worked on it this year and also last year. And so it's about MRI compliance in patients at high risk for breast cancer at our hospital. So thank you everybody for helping out, and I'll be doing the presentation to the best of my ability. Sorry, I just haven't been able to go through it too much, so excuse any fumbling. So our presentation is about MRI compliance in these high-risk patients. It's recommended by many societies. And the way to assess patients' high risk is of breast cancers with the Gale model or the Tyler-Krusig model, which is recommended now, which uses extensive family history, age, hormone exposure, benign breast disease history to calculate the patient's risk. So recent studies show that 10% of patients with high lifetime risk for breast cancer undergo further testing, and it also shows that if patients were more aware, they had better compliance. And further imaging recommended is contrast enhanced MRI. So our study just goes into depth about the various factors that patients can have that affect their compliance rate, and it also specifically looks at extra verbiage at the end of the radiographic reports, and the extra verbiage includes the Tyler-Krusig score, and some of them do not include the Tyler-Krusig score, and we'll compare the compliance rate. So we look back, it's a retrospective study from January to December 2018. Just patients who are screened to be more than 20% based on the Tyler-Krusig score. And so from total of 707 patients who were screened to have a high lifetime risk of breast cancer, 136 had breast MRI. And race wise, African Americans did show to have a lower rate of compliance, but there isn't too much data besides white. And family history, their patients who had an MRI did have more relatives with a history of breast cancer, and had more first-degree relatives too. But in terms of screening modalities, there isn't much of a difference in MRI compliance after that. And there isn't too much difference even when the risk percentage based on Tyler-Krusig is taken into account. And the same thing. Okay, so the results, like I said, there's a 19% compliance rate, and of the group that had a breast MRI, 40 patients underwent a breast biopsy. Of these 40 patients, 28 received benign results, while 12 received malignant results. And then the group that did not complete a breast MRI. 34 patients underwent a biopsy. Of these 34 patients, 26 received benign results, while 8 showed malignancies. So not much difference. So it's important to know that patients who didn't receive MRI are still high risk, and there is a high percentage that they can be malignant. So let's see. And we found out that the patient reports who received the extra Tyler-Cuzick verbiage did show greater compliance rates, 32% versus 19%. So could be indicating that like the extra verbiage, which could inform the primary care as well as the patients that they are high risk, that this could be a key factor to follow up on compliance. So biopsy results and percentage of those who underwent MRI with and without extra verbiage are also identical. So the extra verbiage may not play a role in this. Some limitations to our study: it's a retrospective study, and it's hard to establish a uniform approach to counseling the patients, but we can do our best, and this is one thing that we looked at that seemed to have made a difference. Future implications: we can further look at the extra verbiage next year and see if we can, there's a continuation of this increased trend with greater compliance, and we can look at other ways in which patient education, counseling, better studies can improve compliance too. That's it. Sorry about all the fumbling, but can do the best I can. All right.